Good morning, good afternoon, good evening. My name is Haneen Sayed, and I'm a member of the Board of Directors of Life. On behalf of LebNet and Life, we welcome you to the second episode of the Engage and Act series, where we spotlight the remarkable work of humanitarian organizations working on the ground today in Lebanon. Over the next few weeks and months, Life and LabNet will be hosting various organizations to share their insight, hear about their challenges and needs. We hope to amplify their voice by raising awareness about their impactful work. Last week, we heard from three incredible NGOs, Beit al Baraka, Arc-en-Ciel, and Rawad. And if you missed that event, it is available on our YouTube. The whole session is available for those who would like to hear it. Today, we are privileged to host the Lebanese Red Cross, represented by Mr. Nabih Jabr, Under Secretary General of the LRC. Before I welcome Nabih, allow me first to introduce briefly the two organizations organizing and hosting this series. LebNet is a nonprofit organization founded in 1999 in Silicon Valley. It connects and empowers over 2,500 Lebanese diaspora members in tech across the US and Canada. Its mission is to support Lebanese tech professionals and entrepreneurs globally through networking, mentorship, and career development. Life was founded in 2009. It is a global professional network aimed at empowering the Lebanese community and working together towards a brighter future. With around 1,500 members across 20 chapters spread across the GCC, Asia, Europe, the US, and recently growing into Latin America. Our impact is on education and job creation. Lebanon today is facing an unprecedented humanitarian crisis. Within just 3 weeks, more than 1.2 million people were displaced from their homes and villages. As of October 19, there were close to 2,500 conflict related deaths and 11,500 wounded. At least 100 health workers were killed while on duty, about 100 primary healthcare centers and dispensaries closed, and 39 attacks on healthcare facilities. The rapid displacement is significantly increasing public health risk, with overcrowding in shelters raising the likelihood of infectious disease spread. Many displaced individuals lack essential supplies, inadequate shelter and water supply will exacerbate health challenges as winter approaches. The government has established some 1,100 shelters, housing about 200,000 displaced. 70% of the shelters, however, are public schools, putting the start of the school year at risk. And anywhere between 300 to 500,000 students are out of school today from a total student population of 1 million. The economic and social impact of the war in Lebanon will for sure be enormous. Today, the Lebanese Chamber of Commerce announced that economic activity in the private sector has fallen by 85 to 90%. And some experts project that the economy will contract by 10% in 2024. Poverty in Lebanon, already high in the war and having had doubled as a result of the financial economic crisis, will likely rise again. To hear firsthand how about this humanitarian calamity and how it's being handled on the ground, as I said, we're very privileged to have today with us Mr. Nabih Jabr. Nabih is in charge of resource mobilization, marketing, volunteering, and local development. He started as a volunteer in the Lebanese Red Cross ambulance services in 1999, like many Lebanese do. In fact, my own home in Jemaise in Beirut, we are right above the Lebanese Red Cross. I'm very privileged, and every once in a while I go down and I meet the new volunteers. This is really what is wonderful about this organization and how it operates. So Nabih, after volunteering, he was recruited as a training manager for emergency medical services. In 2014, he was appointed Undersecretary General and was responsible for the organizational development program of the National Society. From 2019, Nabih has focused on establishing a fundraising program for the LRC to improve long-term sustainability and was in charge of coordinating the fundraising for the direct financial assistance program ensuing the 4th of August Beirut port explosion, which many of you probably remember, which also Life was mobilized to support. Following the financial crisis, Nabih has started working on the reform and scale up of the primary healthcare department to help address the growing gap in access to basic health services in Lebanon. So, welcome, Nabih. I want to say before I give you the floor to our participants, you can either put your questions into the Q&A, or you can actually raise your hand, and we'll try to have this interactive and more lively discussion. So, Nabih, I'm going to start first by asking you to describe the situation on the ground today. It's very grave. And just before we started, you mentioned to me in Sur today you had potentially an injury, one of your volunteers. Give our listeners a sense of what's actually happening and how it's developed over this past month when the war started in its intense phase.
Good evening, everyone. Good evening, Haneen, and thank you for the introduction. Um, the the escalation has been, everybody expected that this could potentially happen since October of last year, but I don't think anybody imagined that it could reach this level of intensity and this massive displacement of people. Yes, the security situation has deteriorated dramatically. It's the fourth incident in which one of our ambulances is hit. Today was the first time that it was hit by bullets, not a nearby explosion, and our volunteers had to abandon an ambulance there and leave in the remaining two ambulances. What's important to note here is that of the 1.2 million displaced persons that you mentioned, about 20% to a maximum of 25% are in shelters. The rest are in homes. So there are many homes, many households that were already severely affected by the economic crisis and the situation in the country, that now have 30 people inside a house that is made for 5, 6, 7 people, and who have trouble having the basic necessities. The situation in shelters is still very difficult. In most of the shelters, you can imagine they are in schools which are not made for this. The sanitation facilities are overwhelmed. Hot water is not always available. The crowded spaces, so many people in crowded spaces, means we will face at some point, and we have started, but it's still contained and limited. But we have to prepare for the spread of diseases. Not to mention the problems people have accessing healthcare, and the long-term impact that it will have on mental health, which is something we don't tend to talk about in the middle of the crisis, but that we have to keep on the radar for as soon as possible, as well as protection against sexual exploitation and abuse, which unfortunately in circumstances such as these, it's a favorable environment for such incidents. So it's also something we have to take into consideration. Today, a big chunk of the remaining population in Sur, in Tir, started evacuating. They don't really have a place to go because most shelters are saturated in Beirut, Mount Lebanon. Even Tripoli is close to the saturation point. Some are trying to head towards Akkar, but transportation is difficult. They leave everything behind and they go. And when they get there, there is not enough support immediately available. And there is a lot of confusion still because of the scale of what has happened. All of this is taking place in a context where, to give the example of the OCHA appeal, the UN appeal is less than 15% funded until now. We, as Lebanese Red Cross, we experienced that. We have precise figures of our own fundraising efforts. If we compare it to August 2020, we have 8 times less funding, although the disaster is 10 times bigger. I mean, we never thought we would face anything as big as the Beirut port explosion, but this is way bigger. But unfortunately, for many reasons, some of which are probably political, the support is much less.
Thank you, Nabih. This is very worrisome what you're saying on all fronts. This is a much, it's a bigger, even bigger calamity, as you mentioned. Who would expected that after Port of Beirut, which was Hiroshima-like event, that Lebanon would face something so even bigger in a different way, of course. Um, Let me ask you then how the Lebanese Red Cross is responding. You have a huge responsibility. I know that you're not just Lebanese Red Cross, a lot rely on you, including the government. You do your own work, but then you're having to expand into other areas. Um, Tell us then what you are doing in this current crisis.
Well, the Lebanese Red Cross, since actually the July 2006 war, so after the July 2006 war, went through a very long and difficult, massive reform process to modernize the organization and bring it into the 21st century. Uh, and uh, we are focusing now our response on what our mandate is and what our peacetime operations are. So our first response, but of course adapted to this crisis. So our first two priorities are the immediately life-saving ones. So we operate the ambulance service in Lebanon, doing about 70 to 80% of all ambulance missions in Lebanon. Uh, and now our ambulance volunteers are on the front lines of the response, especially in Sur and Tibnin and the northern Bekaa and parts of Beirut. Um, Under the Litani River, exactly as it happened in 2006, nobody is left except the couple of hundred volunteers of the Lebanese Red Cross who are every day facing increasingly difficult missions and running out of ambulances because so many have already been damaged, and those that are not damaged by shrapnel are damaged by the rubble, and there are no more proper roads practically there. Uh, so this is our utmost priority, and also our urban search and rescue teams are helping the civil defense and other agencies to search for victims and survivors, especially under the rubble. So this is a new unit that was established a couple of years ago and trained. They used to do one mission per year when we had a building crumble and so on. And now in these past few days, in this past month, they've done 25 missions already. Our second immediately life-saving priority is blood. So Lebanon relies more and more, and hospitals in Lebanon rely more and more since COVID and the economic collapse on the Lebanese Red Cross to provide more than half of the blood units that are in Lebanon. And with the severely wounded, there is a much bigger need for blood. But we are facing difficulties because every blood, even though people often think that blood is free because people come to donate blood, and of course, they give their blood for free. But processing a blood unit has a cost, the cost of the blood bag, the reagents, the machines, the technicians, and all of that, the operations. So this is becoming more and more challenging because the need is increasing and the means are not matching them. So these are the first two life-saving priorities that we have. Now, at a second level, our primary healthcare, we're one of the, if not the single biggest primary healthcare provider in Lebanon. Within peacetime, we had about 120,000 patients per year. Now all of the people who have left from the south have lost their access to their usual primary healthcare. So we try to provide them with that through mobile clinics. So we have 36 fixed clinics, of which 10 are in the south and have now shut down. But we have the staff and volunteers are now working in mobile clinics to try to support as many of the million people. So they're spread throughout Lebanon. We can go into the details if some people have questions about this. Fourth is what we call relief. It's providing at this stage basic assistance to people. So food, ready-made meals, food parcels, hygiene kits, blankets, uh, and also helping to do quick fixes in terms of water and sanitation, meaning going into the shelters, making sure the toilets are functioning, there is hot water available, and so on. And finally, our teams also try to work on are now starting to scale up efforts to raise awareness within the shelters, what to do if a shelter is warned that they have to evacuate. So how to evacuate in a quick, organized way rapidly, because very often the warnings that are being given are 10 minutes or 15 minutes prior to a huge strike. So if that happens to a shelter, we need to be prepared. So we're trying to focus our efforts on that, on early detection of contagious diseases, and on preparing community first responders. So this is something that we traditionally do, so empowering communities, because they are the first responders even before our own teams arrive. So this is in a nutshell what we focus our efforts on.
Thank you, Nabih. One question that's come in already is some stats on the refugees and shelters. So, how many refugees or displaced IDPs have found a shelter, and how many are still looking for shelter? Do you have the numbers on that?
So we know that 20 to 25% of the 1.2 million, so that's about 250 to 300,000 people, are informal shelters. When we say shelter, we mean the shelters that are designated as such by the Disaster Risk Management Unit, by the authorities. The rest, we don't know if some of them, how many are on the street and how many have found alternative accommodations or are staying with people or friends, or informal shelters, meaning some occupy an empty building. So no, we do not have a precise breakdown of those, and it's very difficult. So the teams they have relatively good data on the people inside the shelters, because there's a system that was put in place with the Disaster Risk Management Unit. They are trying with the municipalities to get data about the majority, so the 80% who are not in informal shelters. But it's very difficult because some municipalities don't have the capacities, and some people, for privacy concerns, are absolutely against giving any sort of data. So it's not, the scale doesn't make it simple, and the circumstances make it even more complicated.
So, when people go to a shelter, do they register? And who registers them? What's the process that takes place there? And then who helps them? Is it Lebanese Red Cross? Is it other NGOs, the municipality? Can you give us a sense of that process?
So yes, when people go to a formal shelter, there is somebody, not all of the time, but if the shelter is working as it should be, there is somebody who is helping to register, to provide them with the basic assistance and so on. Now, in the first 2 weeks, the reaction time was not quick. So there were people who came into shelters and there was nothing there. There was nothing there for them because the scale and the speed at which this happened and the scale of it overwhelmed the capacities. So there weren't enough resources. For example, the contingency stocks that were in place were not made for 1.2 million people, or even for the 300,000 people that came to formal shelters. Who helps them? In some parts, it's the Lebanese Red Cross, but there are a host of other NGOs and UN agencies that are also working there. Now, the efforts are now ongoing to have a better to be able to not to repeat the errors of the Beirut port explosion response, and to have all of the NGOs and UN agencies working in better collaboration. It is much better organized than it was back in 2020. But again, and I'm going to keep repeating that, the scale makes it also much more complicated. What we're trying to do, when I mean we, I mean all of the agencies responding, is to make sure that there is as little duplication as possible, so that we can use the resources that are way less than the needs in as optimal a way as possible.
In fact, thank you for this. In fact, I wanted to ask you, what are some of the lessons from the 2020 Port of Beirut explosion? If you can expand a little bit on this, I think it will be important. All of us could learn from this, trying to help. Can you reflect a little bit on this?
So, I mean, there are expanding, going into into the details of that would take a few hours. There are piles and piles of documents about the lessons learned and the mistakes we made. I'm talking as Lebanese Red Cross. The biggest problem that we had at the time was our data management systems were not good enough. So we had some help from UNHCR experts on this and so on, but we were always trying to catch up. Eventually we did, but the difference is that it was constrained. It was limited in the area at least. So there were 40 to 50,000 families that were affected. Now we're talking about 250 to 300,000 families that are spread all over Lebanon, and the disaster is ongoing. It's not that the disaster has happened and then stopped, and then we can focus on the response. Plus, we had the means, so this is the big difference. Another lesson, apart from data management, was the complaints and feedback mechanisms. It may not sound like a huge thing, but it's very important to be able to for the people we are trying to help to have voice, to have channels to raise their concerns, because mistakes will happen. We didn't have such a system. So it's in fact during the Beirut port explosion response that we established our hotline 1760, which is designated for operation 24/7, and so that people can always reach out to us.
Thank you, Nabih. These are all really important. 2020, the Port of Beirut just seems like years away, although it's actually only a few years. But I think it's very important to constantly be reflecting about lessons. Well, one of the things you also mentioned is the coordination, and that coordination is very important among the many NGOs, and we know that many are working on the ground now. So, how do you see that? I know that's not LRC's responsibility, but there's an umbrella, that committee that the government has created. How is that coordination happening? So, and take us through, let's say some aid comes in, let's say, I don't know, an airplane from UAE or from UK or from somewhere. Does Lebanese Red Cross have a role? How does that aid get distributed?
So let me start not from I'll get to the aid part, but the main thing about coordination is number one, understanding the situation. This is the difficulty. This was the big difficulty in 2020. And now there is at least a mechanism and tools and a forum in which to build this common understanding of what the needs are. Now, it will take time for example, the data management system that the Lebanese Red Cross supports the disaster risk management unit with provides information about each shelter, where it is, what is its capacity, how many are already there, who's the focal person, which NGO is working there, and what services is it offering. So these are the main things. Now the challenge that we have is extending this or adapting this to people who are outside of shelters. So we recently launched a self registration form so that people who are not in a shelter can register. So that's the first part. The second part is bringing everybody together. So there's also a way for NGOs who wish to help, who have resources to register and to participate in the meetings and so on. And the next level that we try to do is to link between the national level and the various ministries that are involved and the local level, the muhafaza or the governorate, and even municipality levels. So this is the challenge that we have horizontally, all of the different ministries, and vertically linking the national to the local. Now, to be very clear, the Lebanese Red Cross is not in charge of receiving the donations that come in or deciding how they are allocated. That's the role of the Disaster Risk Management Unit attached to the Prime Minister's office. We are in charge of receiving and managing our own the donations that are sent specifically to the Lebanese Red Cross. And that's all. So we work closely with the government and agencies and other NGOs, but we have our distinct accountability mechanisms and fundraising and accounts and fundraising channels and logs of what we receive and how we distribute.
Okay, so let's come to that then. Tell us about your needs, your appeal, your call for action, and how people can contribute. And somebody's asking already in the chat, how can they contribute beyond financial? Is there anything that the diaspora in particular can contribute in terms of skills or otherwise?
So the most critical thing I said in the introduction in the beginning, that it is shocking to see the discrepancy between the response of the world, individuals, the corporate sector, and governments between 2020, even 2006. I was a volunteer in 2006. I was involved a little bit in the national response. It was completely different than now. It's as if there is a sort of embargo on Lebanon that will reduce support to the extent possible. Sorry. So that's so to answer your question, raising awareness is probably the biggest role that people like the people in your participants in this meeting can do. Raising awareness about the humanitarian needs, putting politics aside, and understanding that there are critical humanitarian needs in a country that already was struggling before this happened. Of course, contributing directly helps, but there's a limit to what each person can do. So, unfortunately, in the media abroad and so on, the situation is not described very accurately. The needs are not portrayed very well. So this is a key. This I would say is the most important thing. Um, our biggest challenges, apart from the insufficient resources, let me say, is safety today, because it's becoming increasingly difficult to operate in certain areas where there are still people who need help. The red zones, what we call the red zones, or the areas that are at risk directly, are expanding. Mm-hmm. This makes it incredibly difficult to respond, and also creates secondary displacements. So people who are already displaced get displaced once again, like we've seen happening in Gaza many times. Another challenge is the internal stability, or what we call social cohesion. This is, again, the situation is not like in 2006, and this is an ever-present risk, because it would add a huge layer of complexity that we could do without now. And then we have the spread of diseases. Winter is coming, so preparing and making sure that it's much cheaper to prevent the spread of diseases than to respond to it once it happens, something like cholera spreads or whatever. We have also to prepare for winter, but most of all, we have to understand that the impact of this, even when it's not on the news anymore, when hopefully the violence ends, the impact of this will last for 2 or 3 or 4 years. And this is the really scary part, that when it's no longer on the news and people are not talking about it anymore, there will still be at least hundreds of thousands of refugees who have no homes to go back to. And the potential social impact of that can be terrifying. So we have to, this is why I come back to this issue, this role that the Lebanese diaspora has of being ambassadors about this, of talking about this, of raising awareness about this for other people to be able to multiply the help that the country gets.
Thank you, Nabil. Nabil, this is really very sobering, and especially your point about how the response globally has been so much less this time around, although this calamity in a way is even more severe and bigger and probably longer term, as you mentioned, enough that children are not going to school, or half the student population in Lebanon may not be going to school this year at all. And so that loss of human capital is just horrendous. Let me pick up a couple of questions. Someone is referring to the Paris meeting tomorrow, the conference that President Macron has called for Lebanon. It's a humanitarian conference. And he's asking, is the Red Cross or other NGOs on the starting blocks to receive some funds, or the help is meant to go to Lebanese administration? Do you know about that, Nabi?
Yes, so the president of the Lebanese Red Cross, Dr. Antoine Zerbeh, will be present at that meeting. He will make a speech. The
Mm-hmm.
French Red Cross is also our partner and is fundraising on our behalf also. So yes, we are present. So some funds, of course, are institutional and will go to the government or to UN agencies, and some other funds will go directly to local actors. And this is a bit part also of the bigger debate about localization, but maybe it's not now is not the time to go into that. But what we try to ask for is that as much as possible as the aid has to go to the local actors, Lebanese Red Cross or others.
Versus the federation, you mean, or the
No, I mean versus international NGOs or UN agencies that also do a great job, but they are relatively well funded compared to local actors. And in terms of sustainability, strengthening the local actors is an important investment, because when the acute phase ends, we will still be here, and the INGOs and UN agencies will move on to the next crisis.
so what percent of your appeal or your call for action is currently funded?
As Lebanese Red Cross,
Yes,
in
yes.
terms of well, the problem is that we don't know how long this will last. So our appeal is based on assumptions. It's based on scenarios. So if we talk about what we have received until now, not the promises made or the commitments, it is
Mm-hmm.
less than 12% of what the needs will be, assuming that this lasts for another 6 months. But this is changing every day because, for example, we have capital, we have centers that are being hit, and we have ambulances that are being destroyed. So this will change. It's very dynamic. We cannot give precise figures now because it's an extremely fluid and dramatically evolving situation.
Reading from some of the other questions or comments, somebody says, as a previous LRC volunteer, I want to send my appreciation to all LRC members today. They are giving so much. How can we show them our support? Do you have any specific needs? I think you kind of explained that. But let me say, we do have in the chat the link to the donation. Maybe, Nabi, again, you can explain when somebody donates uh, to LRC, where does it go and what is it funding? Do they get to kind of pick among the four priorities you mentioned, or this goes into a central pot that LRC allocates?
So it's what we did in 2020. It's impossible to manage thousands of donations that are treated as mini projects. We couldn't do that. So we decided back in 2020 that we would put all the funds in one pot and use 80% of that to help at least 10,000 families with $300 per month for 6 months. We ended up doing 7 months, 11,500 families for about $24 million. We're doing almost the same now, except the funds are much less. Every donation will go towards, first of all, our top three priorities, because we're receiving a lot of in-kind donations for food parcels and hygiene kits and so on. So it will go to fund the ambulance response, blood units to save lives, and primary healthcare, because it is basically linked to our mission, and we have the capacity to do that, and it's a critical need. So, and we report back to all donors about all of this. So everybody who donates gets on a mailing list, they receive our reports, and eventually we receive the evaluations and audits and so on. But that's after the close of this operation, of course.
Mhm. So somebody's asking, has the government been involved to support you? They're saying the mayors and municipalities have been active, wondering if the central Lebanese government is.
So the Lebanese Red Cross, an auxiliary to the public authorities. It means we have our independence, but we're not an NGO. By our mandate, the Red
Mm.
Cross in any country in the world has to work closely with the authorities. So, for example, after the end of the civil war, the Lebanese government mandated the Lebanese Red Cross to help with ambulances and blood because they didn't have the capacity to do it. So they used to contribute an amount, about 30% of the budget for these two services. When the crisis happened, it stopped completely. So we lost 30% of our budget for ambulances, blood, and primary health. And so the government does not have the means financially to help the Lebanese Red Cross since 2019. 2018 is the last time we received this budget to do something that typically the government does. So in the countries where the diaspora is living, typically this is paid for. These are services that are paid for by the government or private insurance. So the government helps us in terms of, for example, now they waived custom fees for donations we received and so on. Yes, in whatever way they can, but not financially, no.
Okay, thank you. Another question, does the LRC give part of the funds received to local authorities or any NGOs? Do you kind of then provide to other local NGOs?
We do not re-grant money ever. So we have not done this in the past. We are not doing so now. Will we do it in the future? I don't know, but it requires lots of mechanisms to ensure because we have to be accountable for every penny that we receive.
Mm-hmm.
So we manage that risk. We do re-grant in-kind donations. The in-kind donations that we cannot use, for example, we receive sometimes equipment for hospitals. We donate them to hospitals, or clothes that we don't handle. We forward them to other NGOs who handle clothing, for example, but not for money, not at all.
Somebody is asking about the volunteers. Are there other needs other than monetary donations? But for the Red Cross volunteers, are there any specific needs that can be provided that?
So we have a few hundred displaced volunteers, and we are working with our partners to try to provide them with a place to live temporarily in a dignified manner with basic assistance and so on. We have a duty to help our own volunteers, and it's right before, actually a few months before this started, we started a small fundraising campaign for peer support for our volunteers because some of your audience are ex-volunteers, and they understand that the typical volunteer joins at 17, 18, 19, and they see things that are quite traumatic and even worse now during this war. So we have a program that we call peer support, which is basically mental health and psychosocial support for volunteers. And this
Mhm.
is something that's ongoing now, that's a bit underfunded. And yes, it's a need. So we have a huge network of psychotherapists who help us with this. So psychotherapists can help directly by offering sessions, by joining this network. Some of them do it on a volunteer basis. Some of them are paid, and also the funds help us to sustain this and to try at least to keep our hotline for volunteers open. That any volunteer who wants to speak out does speak out.
Very good. No, that's important. That's very important. Uh, Somebody is asking, actually, and interestingly, can telehealth efforts help you? Um, Virtual healthcare outside Lebanon. Can that is Lebanese Red Cross in that space? Is there something that you're exploring? Because obviously we have a large diaspora which has a lot of skills, and maybe this is something that can be connected to you.
So in terms of primary healthcare, there was a small experiment that we did. Telehealth is very difficult for people to accept still. Not to mention that the technology into the infrastructure. Let's not forget that a lot of the telecommunications infrastructure has been severely hit. So it's difficult to do telehealth when you don't have that operating well, and there are no alternative means. Starlink and so on doesn't work in Lebanon. At the primary healthcare level, it's important to have this contact with the patients, and we have this capacity. At the secondary healthcare level, hospitals, which we don't do as Lebanese Red Cross, we don't operate hospitals. This could be something. I can't speak for it, but potentially it could be something that the diaspora can help with.
Yeah, and I'm aware that the Ministry of Public Health has several of those initiatives, but that's probably something good to build up on, take offline with the ministry. Um, Somebody is also asking, is there a central command unit that coordinates all NGOs, Red Cross, and government aid distribution? Um, yeah, you
Yes,
partly said that. Yeah. Mm-hmm.
that's called the Disaster Risk Management Unit.
Correct.
So that's the role of this unit.
Right. And in fact, as a little bit of an appetizer, we will be hosting next week Minister Nasser Yassin, who is the person in charge of the government's emergency response. So we'll have a lot of these questions also could be asked to him. Um, Mental health and support funds is a way that we can donate to this. If somebody's interested in directly donating the mental health efforts.
So there's for people who want to allocate a donation, we can add. I can add in the chat an email address where people can ask for that.
Mm-hmm.
If it's done via wire transfer, it would also be it can be allocated. Yes, we can allocate for these things because unfortunately we get our funding mainly to help others, but we also have to keep in mind the volunteers. So I appreciate this question and this offer.
Okay. And then Alexandra is offering to connect about her NGO does psychosocial first aid for children. So please make the connection, Alexandra, with Nabih. I'm sure he'd be happy to discuss further. And these are the kind of connections we'd like to promote through these sessions. Absolutely. Um, Great. So Nabih, I just want to give you maybe a chance at the end to give us some final words about what would you like the diaspora to come out of this in mind? And, be specific if you want to be. I very much appreciate what you said about awareness, that this war, this conflict, is not getting the kind of attention. Part of that has to be because the world has been so tired with a year seeing the genocide happening in Gaza, and to many people outside, it's just another thing in the Middle East, unfortunately. But now, this is on top of what we all went through with Gaza. This is now our country, and it's our responsibility to help save it. So, any words that you want to give as a final few comments, please.
So before I give the final comments, I think it's important for people, especially who are based in the US, to understand that when they donate, there are no tax. If they donate directly to the Lebanese Red Cross, there are no tax deductions possible because we're not registered as a 501c3 in the US. So there are other ways to donate to the Lebanese Red Cross while benefiting from these tax deductions. For example, in Canada, you have a partnership with the Canadian Red Cross and in a few other countries. In the US, we have alternative means. So I think the email address should be visible to people. They can reach out. We can assist with that. The second, I'd encourage people. I mean, part of my role and with the support of the team that works with me is to ensure good communication with people, with donors, with supporters, with people who want to raise awareness. So we respond generally to all queries in 24 hours. They can use this email address or our website, the form on our website. So I'd encourage people to ask questions, especially when they hear. Unfortunately, there are many rumors that are being spread. This morning, for example, we woke up to a picture of two Lebanese Red Cross ambulances in front of Sahel Hospital, and an indication from a Facebook account that was created a few hours before that. That was the only post saying that the Lebanese Red Cross is transporting money from that hospital. So these are extremely harmful and a big security risk to the volunteers. So it's important to fight these rumors whenever there's a doubt, to reach out and ask us. And for the rest, I'd encourage people to have. I hope that this will have a ripple effect. If you have groups of people who'd like to ask questions, who'd like to know what's going on, let us know, and we can answer their questions. We can provide information about what we do.
Thank you, Nabih. So yes, absolutely. I mean, we very much encourage people to contribute. What you said is that you're only 12% funded. This is actually very worrying. We need to keep raising awareness. We need to get Lebanese and non-Lebanese to help out. So we will continue. We'll do our best, and my colleague Nadim Matta says one more comment. We may need to develop talking points for awareness building in the US. Enables us to reach the people who otherwise would be alienated if we speak our mind without any filters. Always well said, Nadim. Um, so I want to thank you very much, Nabi, and you and the volunteers. Please send our regards to all of them. They're doing heroic work on behalf of everyone, and you have our support, and we will stay in touch. And thank you very much for taking the time to speak with us. And thank you all for participating.
My pleasure. Thank you for organizing this, and have a great evening or day.
Thank you, you too.